I'm happy to welcome you here. I'm Adrienne Windsor. I am a member of the board of the Public Library, Newport Beach Public Library Foundation. So we welcome you here tonight. The foundation is a sponsor for this program, Medicine in Our Backyard, along with UCI's Department of Medicine and Health Sciences. So we'd like to thank our generous sponsors, Mike and Polly Smith. They are not here tonight. They usually are. I want to tell you a little bit about these benefactors. They were the instigators in creating this program, and they have for years sustained it and supported it financially. So it's quite a wonderful gift to us. And it's also a gift from the university that we are able to bring this to you and do this for you. How many members of the foundation do we have? Well, wave your hands, and would you all look around? And if you're not one, wouldn't you like to be a part of it? We would love to have you join our foundation. The foundation works with the library. We supplement the library's budget with things that the city does not provide. Each year they give us a wish list. And some of these are really wonderful. Our periodical library, part of that has come from the foundation. Our media laboratory, if you haven't been in there, you can record your own audiobook and do it right there in the sound studio. The chairs you are sitting on were donated by the foundation. So this is a great group to belong to. You receive advance notice of the lectures that we are having, of our programs, and it's our bookmark. And the other thing that you gain from it is being with the people who are around you, surrounding you tonight. So just look around, say hello to somebody, create a friendship. Now, a few reminders about our evening. It will close with Q&A, so please do not ask questions during the presentation. We will have 15 minutes for questions at the very end. And I want to tell you, too, on November 14th, Library Live will be sponsoring the first surfing family in Southern California, Dee and Herbie Fletcher. So if you're not a surfer, bring a surfer. Or solicit a surfer, or tell a surfer. But it should be a great evening for us. And so now I'm pleased to introduce our speaker. This is Dr. Cynthia Hawk. Cynthia tells me she hails from Indiana, from a small town, and has been surrounded by family all of her life. She's a very genial and warm woman, as well as a woman of great accomplishments. She is the chair of the Department of Family Medicine at the UCI School of Medicine. It's always wonderful to be in the presence of women who have broken through the glass ceiling and reached the top. So we're happy to have you here for that. She's a champion for primary health care, health equity, and preparing health professionals to serve the disadvantaged patients and communities. She received her BA and her MD from the University of Indiana, and she has led programs to recruit and train health physicians and health professionals, actually from all over the world. She has designed and evaluated programs in Pakistan, Uganda, Ethiopia, and with the World Health Organization, and with governmental and non-governmental organizations. She's going to be speaking to us tonight on health equity, why the U.S. is lagging behind other countries. So please join me in welcoming Dr. Hawk.
Thank you for that kind introduction, and thanks to all of you for coming out on a Monday night. And I hope we're going to have a great discussion, and there will be time for some back and forth. So I'm really delighted to talk about this topic here in Orange County because we happen to be sitting in perhaps one of the wealthiest counties in one of the wealthiest countries in the world. And yet, that wealth is not spread evenly, including health. And so we're going to talk and explore that question over this next hour or so. And the big question that I have for us is, what kind of world do we want for ourselves, for our children and grandchildren? What are the legacies that we want to leave for those who follow us? And health equity is really at the heart of this. We're going to talk about what it is, why does it matter, what actually determines our health? Where does our health come from? Why is the United States 43rd in the world for health outcomes? Why is that for one of the most wealthy nations in the world? And on top of that, why has the U.S. life expectancy actually been declining? It's been going down for the last 3 years in a row. For the first time, really in the last 100 years, our life expectancy is declining. And then we'll talk about what actually can we do about this. And we have a very finicky cord here, so first, just a little bit more about me. I'm a family doctor, and very proud family doctor, and I have spent my entire career really thinking about some of these questions we'll talk about tonight. I grew up partly in Pakistan. My father came from India, and as a child, I saw a lot of poverty. I saw a lot of children who didn't have enough food to eat, who didn't have proper clothes to wear. And it troubled me. Why was I so lucky? Why did I have what I needed and so many others did not? And my mother's response was, "There, but for the grace of God goes you." Her response was, "I got lucky. Really, I got a really lucky card because I got born into a family that gave me lots of love and protection and those things that I needed." And so as I came along and decided that I wanted to be a physician, I decided I'd like to work in areas where the needs are greatest. I'd like to be able to make a difference for those people who haven't been as fortunate as I've been. And so after my residency in family medicine in Wisconsin, my husband and 3 children and we went to Uganda. And this was 1986. And I was a physician working in a rural part of Uganda. I became the medical director of a health center, and my job was to try to improve child survival. Uganda had been through a brutal civil war, and 1 out of 3 children died before the age of 5. 1 out of 3. And most of these children were dying from very preventable causes. Lack of immunizations, clean water, etc. And so my job was to serve as medical director. We cared for about 500,000 people. And I was the only doctor in that center. But I worked with a dedicated group of nurses and midwives and outreach workers who had worked even through the war, even with no pay, because they were so dedicated to serving their community. I developed a course to train the village health workers, and you can see me up in the right-hand corner here. I did a lot of time visiting in homes. We trained the village health workers to intervene in the main causes of child mortality. And we went to the village to introduce the worker after he'd completed the course, and I was sitting in an area about half the size of this room, but filled with the villagers and the village chief, and working through interpreters and so forth. But at one point, the village chief stopped and he said, "Doctor, you're the most educated person who's ever come to our village. We're so grateful that you're here, and we thank you for training our village health worker. But," he said, "do you know we don't have any water?" And I was a little taken aback, and I was like, "What? What did you say?" He said, "We have no water." It was 3 kilometers, over a mile, to walk to a muddy ditch where they would collect water in cans and bring it back to the village. And it hit me hard that, I was so proud that I was trained as a doctor. I knew all the best treatments and therapies, and I could put IVs in and bone marrow hydration for very severely dehydrated children. But it really struck me that I could be the best doctor in the world, but I couldn't make much of a difference in that environment because there were so many other things that were influencing the health of our patients. It was not just about access to medical care. And it got me thinking, maybe as a doctor I could do other things as well as treat patients. Maybe I can become an advocate for the health of communities. And so I really started at that point reconsidering my role as a doctor, not just to treat the sick, but to promote health at the community level. And so I learned so much from that experience that really set me on the rest of my career. So what is health? What is health? I say it's our most precious resource, because without health, we do not have life, liberty, or the pursuit of happiness. We can't do anything without our health. And absolutely, it is the most precious commodity. The World Health Organization says it's a state of complete physical, mental, and social well-being. But we know this isn't ideal. Very few of us are in that complete idealistic state of perfect health, but that's something that we can aspire for. It's something that we as a society can try to promote the opportunities for people to reach the best possible state of health. So then what is health equity? Health equity is this ideal that everyone in the world should have the chance to achieve the highest possible level of health, because that will enable them to achieve everything else, right? You can't go to school, you can't work, you can't lead, you can't do anything without that health. Health inequities are differences in health that are avoidable, they're unfair, they're unjust. These are differences that could have been prevented, right? Health disparities, differences in health between groups of people. Now, some health disparities cannot be prevented. For example, women are more likely to get breast cancer than men, right? That's a health disparity that we cannot prevent. But there are others, like life expectancy. We have groups of people who live 20 years less in the United States than other groups of people. And we know by and large, many of those causes could have been avoided, right? We also say that equity is not the same as equality, okay? Because there needs to be attention according to need, all right? So in order to achieve the same level of equity, there may be some differences that are required. For instance, women need different types of access to health care because of their childbearing role than men. And so we need to make sure that there is care provided according to need, right? Okay. So now we'll get into where does health come from? What actually contributes to our health and well-being? And we know that this is a very complex puzzle. It's partly about our genes, how we're born, our DNA, the deck that we get handed at birth. But there are so many other things that factor into our health outcomes. And we'll talk more about this as we go along. So, as we think about what determines health, I'd love to hear from you. What do you think are some of the most important things? Just call out. Feel free. Yes. Okay. Okay, so clean water, emotional well-being, social support, right? Good food, physical activity, just moving. We know how important exercise is for our health, right? Education, you're so right. And we know that education is one of the most powerful determinants of long-term health outcomes. When I was working in child survival early on in the developing world, we knew that the child's likelihood of living was most highly correlated to the mother's level of education, because mothers who are well educated are able to recognize when their child is sick or to make the kinds of choices needed for that child to thrive, right?
Comfort.
Comfort, say more.
Living in air-conditioned frozen room cannot be healthy.
Right, right. So we have a kind of a range of conditions. Yeah, just temperature. And we know that the temperatures are changing, the weather patterns are changing. And we're actually getting data from around the world that changing weather patterns are profoundly affecting health outcomes, for sure. Anything else? I'm going to show you a little bit of some interesting data that's come out of the public health community, showing that many of these factors that you've just mentioned are indeed the most important. Education, employment, income, okay? Poverty, right? The very strong correlation with health. Safety in the community, social support, emotional well-being, a feeling of connectedness, of belonging, of being welcomed, makes a difference. The physical environment, the temperature, right? And other things like, are we exposed to toxic chemicals or motor vehicle accidents and so forth and so on. Our health behaviors, what is it that we do on a daily basis, how we live, work, and play, has a very profound influence on our health outcome. And so much of our health behavior is actually linked strongly to our physical environment and the socioeconomic factors. Because our ability to exercise, for instance, may be linked to where we live. And are there indeed safe opportunities to exercise in that area? So look at all of this. So where's medical care in all of this? Actually, not much. So all the billions of dollars we pour into health care services, medical care, actually has a very small impact on health. Now that small is important because we have seen a lot of progress over the last 100 years and a lot of amazing developments that are allowing people to live longer than ever before. But it's really all of those other things that have a more profound influence. So I'm going to take a pause from talking and show you a very brief video, because it's absolutely my joy and pleasure that we have made so much progress in terms of health outcomes in the last few hundred years. And certainly over the course of my 30-plus year career as a physician, I've been able to see a lot of this progress. And you'll hear from Dr. Hans Rosling, unfortunately the late Dr. Hans Rosling, who was a Swedish epidemiologist who recently passed away, but his legacy lives on through this work.
Visualization is right at the heart of my own work too. I teach global health. And I know having the data is not enough. I have to show it in ways people both enjoy and understand. Now, I'm going to try something I've never done before. Animating the data in real space, with a bit of technical assistance from the crew.
So, here we go. First, an axis for health, life expectancy, from 25 years to 75 years. And down here, an axis for wealth, income per person, $400,000, $4,000, and $40,000. So down here is poor and sick, and up here is rich and healthy. Now, I'm going to show you the world 200 years ago, in 1810. Here come all the countries. Europe brown, Asia red, Middle East green, Africa south of Sahara blue, and the Americas yellow. And the size of the country bubbles show the size of the population. And in 1810, it was pretty crowded down there, wasn't it? All countries were sick and poor. Life expectancy were below 40 in all countries. And only UK and the Netherlands were slightly better off, but not much. And now, why start the world? The Industrial Revolution makes countries in Europe and elsewhere move away from the rest. But the colonized countries in Asia and Africa, they are stuck down there. And eventually, the Western countries get healthier and healthier. And now we slow down to show the impact of the First World War and the Spanish flu epidemic. What a catastrophe! And now I speed up through the 1920s and the 1930s. And in spite of the Great Depression, Western countries forge on towards greater wealth and health. Japan and some others try to follow, but most countries stay down here. Now, after the tragedies of the Second World War, we stop a bit to look at the world in 1948. 1948 was a great year. The war was over, Sweden topped the medal table at the Winter Olympics, and I was born. But the differences between the countries of the world was wider than ever. United States was in the front, Japan was catching up. Brazil was way behind, Iran was getting a little richer from oil, but still had short lives. And the Asian giants, China, India, Pakistan, Bangladesh and Indonesia, they were still poor and sick down here. But look what is about to happen. Here we go again. In my lifetime, former colonies gained independence, and then finally they started to get healthier and healthier and healthier. And in the 1970s, then countries in Asia and Latin America started to catch up with the Western countries. They became the emerging economies. Some in Africa follows. Some Africans were stuck in civil war and others hit by HIV. And now we can see the world today in the most up-to-date statistics. Most people today live in the middle, but there are huge differences at the same time between the best of countries and the worst of countries. And there are also huge inequalities within countries. These bubbles show country averages, but I can split them. Take China, I can split it into provinces. There goes Shanghai. It has the same wealth and health as Italy today. And there is the poor inland province Guizhou. It is like Pakistan. And if I split it further, the rural parts are like Ghana in Africa.
And yet, despite the enormous disparities today, we have seen 200 years of remarkable progress. That huge historical gap between the West and the rest is now closing. We have become an entirely new converging world. And I see a clear trend into the future. With aid, trade, green technology and peace, it's fully possible that everyone can make it to the healthy, wealthy corner.
Well, what you just seen in the last few minutes is a story of 200 countries shown over 200 years and beyond. It involved plotting of 120,000 numbers. Pretty neat, huh?
Let me get back again to health equity, okay? Equality. Everybody gets the same thing. But not everybody needs the same thing, right? The little short guy has the same kind of box, but he can't see the ball game, right? Equity, okay? Care according to need, right? Short guy needs more boxes. Otherwise, he'll never see the game, right? And yet, in reality, this is what we have, right? Some people have much, much more, and others very much less. And oftentimes they are even starting off in very unequal positions, right? So then how does this apply to health? We've talked a little bit about the social determinants, what we do as an individual, what's going on in our family, in our social environment, what's happening in our community, what's happening in terms of policy that's influencing what goes on in our community and what we can and can't do. All of these have a bearing on our health outcomes. And these factors tend to accumulate over the course of a person's life. What we call the life course perspective on health is that we have advantages and disadvantages that come even before we're born. In many cases, the mother who's bearing the unborn child isn't healthy, and that child may not be born healthy, right? Depending on the circumstances that the child is born into, if they have a lot of support and encouragement in early childhood education, that child is going to soar much more quickly than a child who's up against a tremendous adversities. We now know that adverse childhood experiences, that is, traumatic episodes in early childhood, actually begin to change the DNA expression. And it begins to change a person's likelihood of developing chronic diseases later in life, such as hypertension, diabetes, cardiovascular disease. Many of these conditions begin to be set even by early childhood. And so these life course factors begin to accumulate, either in terms of pluses, advantages, making us more resilient and healthy, or disadvantages that make it harder to rebound. So now why does the United States rank number 43 in life expectancy? And we've actually fallen. Since the video was made, we've actually fallen quite a bit. We're losing our standard as a leader in world health. Most of the gains in life expectancy that happened over the 20th century were due to public health interventions. Some of the gains were due to advances in medical therapy, and those advances are quite remarkable. Marked reductions in cardiovascular mortality, improvements in life expectancy with cancer treatment. And so I certainly don't want to diminish the importance of those medical advances, but most of our gains are due to public health interventions and addressing some of these social factors. Why are we ranking so low? Even for children in the United States, we rank number 36th in the world. 36th for child health in the world because of all kinds of things that, such as infant mortality. A black child born in the United States today is 2 to 3 times as likely to die in the first month of life as a white child. And this is across the country. Why is this happening, right? We also are seeing a very large increases in what's called deaths of despair. This is a very sad statistic. Since 2005, a 50% increase in U.S. deaths from suicide, alcohol and other drug use. 50% increase in just a decade. And this indeed is what's driving a lot of the decline in life expectancy, is deaths from opiate overdose and from violence, from suicide, deaths from gun violence. I'm embarrassed to say that the United States has higher rates of death from gun violence than Afghanistan, for gosh sakes, where a war's been going on for the last 30 years. And of course, you know that we have more guns available to more people in the U.S. than almost any other country in the world. And so we have some very serious and complex, what we call wicked problems, contributing to our declines in mortality, or declines in life expectancy, or increase in mortality. Additionally, I'm sad to say that the United States healthcare system, our healthcare delivery system, is not doing so well either. We spend more than twice as much as most every other industrialized country in the world, and our outcomes are worse. How can we spend more and get worse outcomes? Why is that happening? So let me bring us to Orange County, what's happening right here in our own backyard. And we know that some of these factors are at play right here, right now. There are strong correlations here, and we've documented it, between socioeconomic status, health, and disability. Mortality, the risk of dying, is 2 to 3 times higher for the lowest income groups compared to the highest. So simply having access to income really makes a difference in terms of access to many of the other things that influence health. And then we can drill down to data, down to the census tract, down to the zip code census tract, comparing one city to another across Orange County to take a look and see actually what's happening right here in our area. And I'll take a moment to just explain this. So if you look, whoops, can't explain it if we can't see it, but let me try to explain while it's coming back. So if you look, take a look first at the bottom for all categories. The black bar is people that are in fair or poor health, and the blue bar is people who report their health. This is self-reported health status as being good or excellent, okay? So you can see about 20% of the people this is in Orange County, report their health as poor, whereas 80% report their health as good to excellent. This is county-wide. If you look at educational level, for those who have a college, starting at the very top, for those who have an 8th grade, high school, or no education, the level of people reporting poor health is almost 50%, okay? And good health, about 50%. So low levels of education are correlating with low self-reported health status. And as you go up to the second from the bottom here, take a look at this one here. If you have a college degree, this is with a college degree, 9% of the population is reporting poor health. Over 90% reporting good health. So you can see how education, the more education, the higher the self-reported health status. The lower the education, the higher the poor health status. Okay? That's right here in Orange County. That's the powerful correlation between education and health status. Now let's take a look at a couple of different zip codes, for example, to see the kind of differences that we're seeing. So this is around approximately Santa Ana, and this is Sunset Beach, Bolsa Chica, Seal Beach area, okay? And so we'll go on to take a look at these two zip codes. 704 on the right, 31% of the population is reporting poor health, okay? Only 12% in the coastal zip code. Going down to obesity, okay? Along the coast, about 15% of obese compared to 25%. Food insecurity, 2%, 15%. Less than high school education, 5%, 40%. So striking difference in educational status, but also in health status in two communities located just a few miles apart in Orange County. And we could do the same thing for Newport Beach and many other communities, comparing and showing very similar differences between those groups. So we know that poverty, low education leads to low opportunities for employment and income and all the other things that conspire and create poor health outcomes. So how do we get here? What's going on? What led to this circumstance? there's a common worldview that if people just work hard enough and pull themselves up, they can all be healthy and wealthy, but not everyone's starting from the same place. There's an idea that if we just let the free market solve our problems, everyone will be taken care of, and that everyone has the same access to education. There's no discrimination. Technology will solve problems. And that government really doesn't play a role in the conditions for health. But indeed, we know that this is not actually the case. There's an idea that if people would be healthy if they just worked hard enough and made the right choices, and that it's up to each and every one of us as an individual to make those choices in order to be healthy. But the problem is, we know that there are these other complex factors that influence people's ability to make decisions. And we know that there are these necessary conditions for health worldwide, not just in the US, but all around the world. And we know also that these social and economic factors are really the main drivers of health outcomes. These determinants are actually created by people, by policies, by decisions that we have made as to what we will invest in. Here in Newport, the Newport Foundation has made a decision to invest in the most marvelous library in the world, and here we sit, and it's absolutely amazing, right? So you've created this wonderful opportunity and resource for the people in your community, right? And so there are communities of opportunity, we call them, where there are many opportunities for people to be included, to develop business, to have connections, own homes, attend good schools, get access to good food, have internet, right? Local governance, parks and trails, all of these are important to creating good health status, whereas in low opportunity communities, we have the exact opposite, and often very difficult circumstances that make it hard for people to make the right choice. And so this comes to one of my favorite poets, Wendell Berry, who says, community, in the fullest sense, is the smallest unit of health. We're about as healthy as those people around us, right? And those conditions in the community around us. And it's all these things together that can really contribute to our health. The World Health Organization has determined that social determinants are indeed the major drivers. And so they've developed this construct of thinking about this social, economic, and political context that influences social outcomes, that influences material circumstances that impact health and well-being. And that indeed we can make decisions to influence those conditions to actually end up with better health outcomes. And this is the concept of what we call health in all policies. Health is not just the purview of the healthcare system. It has to do with education and food and transportation and all of those other sectors that together create those conditions for health. So the World Health Organization and many others have finally come to understanding these social determinants as those fundamental causes. Resources are critical to maintaining the advantage. Higher income individuals are better equipped to take advantage of new knowledge, and inequalities will continue to rise until those causes are addressed. And we can't buy our way out of this with more sophisticated and expensive healthcare technology. There's no substitute for those basic conditions for health. So then what can we do about it? What is it that we can actually do? So we know as clinicians, within our Department of Family Medicine, for instance, we are now screening for social determinants, checking with our patients to talk about some things about social support and education and access to healthy food. If patients need these things, we can help to connect patients to appropriate resources to try to address some of the gaps and try to send patients or connect patients with resources that will help them address those issues. We know there's discrimination built in the healthcare system, and so we need to recognize and train ourselves to address bias and to express compassion so that patients who come are treated well with dignity and respect regardless of their economic circumstances or background. And as the public, we can advocate for pro-health policies. We can join forces, organizations. A group like the Newport Library Foundation can actually make a difference through educational fora like this. And we can address some of the structural barriers that prevent people from accessing those conditions they need for health. Universal access to health care, we know, is a very important part of the puzzle. And we still have tens of millions of people in the United States who do not have health insurance. We're the only industrialized country in the world that does not ensure universal access to health care for everyone. What happens for those patients who are uninsured, I can tell you because I'm on call. I've seen patients coming into the emergency department, the hospital, who could have been prevented from landing in the hospital if only they had access to good primary health care. But that's hard to access without health insurance because the costs have become so high. And so if we're going to aim for health equity, we need to take really a very holistic approach, strengthening communities at the grassroots level from the ground up, expanding our understanding of what is it that actually contributes to health, and then considering policies that will promote health for everyone, particularly those who suffer from health disparities. And health in all policies mean we have to think about health care, not just in the health system, but in housing, transportation, water, and so forth. We need to think about this very big picture. And here in Orange County, actually the Orange County Healthcare Agency is embarking on a very strong county-wide program to really promote health in all policies, starting with a foundation of basic early childhood education, clean air, transport. Everyone should have a home, changing the context so that people can make healthy choices, and making long-lasting preventive interventions so people are protected. And certainly within our Department of Family Medicine, health equity and advocacy remains really a centerpiece to the work we're doing in our department with clinics across Orange County trying to improve access to primary health care and collaboration with other sectors and the public health department and education to really create these conditions for health for all. So I'll end with a few questions for you, and I'd love to have a discussion for why does this matter? Why does health equity matter to us? And what can we do to promote it? Thank you very much. And so everyone's health affects our health because we're all in this together. And that's why I think health equity matters, and that's why I'm just so encouraged that so many of you came out to hear this topic tonight, and that you may become advocates yourselves to help bring about the changes we need.
Thank you so much, Dr. Hawk. Thank you for coming.